and gentlemen, Auntie Mello Show. Yay, today, get geared. I've got a guru in the medical field. Most women struggle to even afford to go to a gyna, I've got a topic that I shared last time about my struggles to get pregnant. And, it took me 7 years to conceive my first baby. And we spoke a lot about that. And I had a lot of people coming in telling me, it's a pain, and it has been a pain. Kana ichitorwadza munhu asina kumbobvira aita mwana inorwadza kunyangwe akamboita mwana. We have people that get married and vobva vazotadza kuita mwana asi akamboita mwana. Toita vamwe vanhu vekuti akatoita vana vake 2 but zvaakuramba haasi kunzwisisa kuti ndiye here murume here chii chiri kuitika. So today I've got Dr. J. Dr. J, how are you? Good to have you.
Hi Melo, how are you?
I'm good. I'm so happy to have you. If I can tell you, when we talk of gurus, I don't know, have you counted? Do you even have the number?
I've lost count.
You have lost count?
Just yesterday,
yes.
I had the privilege of meeting one 7-year-old.
7-year-old?
Yes.
Roughly per week or per month, how many kids do you deliver?
I'm humbled, maybe around 30.
Around 30?
A kid a day.
A kid a day.
Yes.
Imagine that. So when it comes to women, one time I'll come with her on another topic. I was talking to her about, us women wanting to, to find things to reduce and to, those things that we do. So she was laughing at me when I was talking about that. But we will come with that topic another day. But today, let's talk about what is called, according to my little knowledge, she'll correct me, secondary infertility, whereby you have had a child before, but it's not coming. Probably it was just a pregnancy, or what have you. But there is nothing. What is that, doctor? What causes that? VP.
Okay, Melo. I always say all kids come from God.
Yes.
They are gifts from God.
True.
And in God's time, it will happen.
Yes.
So what is subfertility? By definition? Subfertility is failure to conceive after 12 months of regular unprotected intercourse.
Okay.
Baba na mai vachisangana zuva rega rega kana kuti vachijamba one day in between, and they are not using protection, no family planning, and they fail to conceive.
All right.
It becomes secondary when they've had a miscarriage or they've been pregnant before, and now they are failing to conceive.
Okay.
Then it becomes secondary subfertility.
And toti munhu atraya kuenda kumadoctors, pamwe ari kunzi hatisi kuona anything wrong with you, pamwe baba vabvumawo vachekwawo vari kuti hatisi kuona anything wrong with you. What does one do? Nguva iri kufamba, pamwe munhu akutoricha mayears ake emenopause, kana kuti nguva yanga achifunga kuti by this time ndofanira kunge ndapedza nezvevana iri kufamba. What's your advice? Zvine chekuita nestress levels dzangu here? Zvine chekuita nechii?
All right. I would say I'm pro-life. I love kids.
All right.
Yes. So I would say for those who are within our generations,
yes,
we've already missed the boat. However, maybe this discussion will help vachiri vana vadiki.
All right.
Pane yatinoti peak age fertility,
right,
which is between 28 and to 32 years.
Yes.
That's when there is the maximum before you start coming down.
Okay.
Before then, when you're young, you're very fertile.
All right.
So you might as well have your babies whilst you can.
Right.
Whilst you are, don't forget to live, because you're chasing other things. Because most women will do their masters, do everything,
yes,
do their career, when then they want to get pregnant. It's too late.
It's too late.
Because there are so many other complications.
Right.
So maybe want to look at the reasons why somebody who has been able to conceive,
yes,
now is failing to conceive.
All right.
With age, naturally, we gain weight.
All right.
Weight gain has been noted to be associated with a condition called insulin resistance.
All right.
Insulin is the hormone which is responsible for movement of sugar from your circulation into the tissues where it's supposed to be bent down.
All right.
If this sugar lingers around your blood vessel, it is stored as fat. That's
Okay.
how we get our belly fat. That's how we gain weight. When this happens, it is also associated, most importantly, with a condition called PCOS or polycystic ovaries.
All right.
With polycystic ovaries, the covering of the ovary becomes thick. You have a peripheral ring of follicles, and there will be so many of them. Some women will develop facial hair. Some women will have excessive hair around the body.
All right.
Yes, some will have beard, some will have truncal obesity.
Yes.
Unosimba padumba apa, round neck, round face, and there is obvious evidence of weight gain.
All right.
Which would mean that to correct that polycystic ovary, all you need to do is to shed the weight.
To shed the weight. All right.
Lose the
all
weight,
right.
then fertility will improve.
Okay.
That's one of the ovulatory causes.
All right.
There are some women who will just get into premature ovarian failure.
Okay.
They will just get menopause early. They are rare, but it happens.
All right.
Then there are tubal issues.
Yes.
There are some girls who are still, okay, I don't want to be personal there.
Yes.
Lest people, make me holier than thou. But the fact remains, multiple sexual partners will predispose you to sexually transmitted infections.
All right.
Which some of them, like chlamydia and gonorrhea,
Yes.
will not present symptoms in you. So you acquire...
Doc, say that again. Are you saying I can get an STI and not have symptoms?
Yes, ma'am. And the infection would then cause your tubes to be damaged. When your tubes are damaged, then you now want to have babies,
You can't have babies.
Some will terminate their pregnancies, backstreet abortions, sepsis will develop because they don't want to be judged when they go to hospital and say, I've terminated.
Right.
So they'll get septic, tubal damage will set in. And when all this happens, there is a tubal factor to the subfertility that comes.
All right.
In as much as men don't age, havanzi vaita menopause, vachembera, but the quality of the sperm deteriorates with time. Alcohol, smoking, deteriorates.
Wait, Doc. I want that clear. So in as much as people look at the woman and say it's because you probably have this, probably you are obese, probably you are this, there's also an aspect of the man not being able to deliver.
I will tell you, I've been humbled by quite a few gentlemen who have come through to our rooms with their women.
Men can come to the gyna?
They come with their women.
Right.
And they have got this secondary subfertility or primary subfertility.
Yes.
You then do a semen analysis where you're looking at the quality of the semen, looking at the sperm concentration, whether the sperm is normal, whether it's moving, the vigor in the sperm. You realize low sperm count for most men.
All right.
So what I've actually realized in some women, because their men have got low sperm count, they cannot make them pregnant. Eventually, with the age, they will end up developing fibroids. So a woman will just say, I've got fibroids. You don't have fibroids. You don't have a problem. When in actual fact, the fibroids have set in
because there's no action.
Yes. Not to mention the conjugal separation. Economics, couples are not staying together. Some who are even staying together, they're always fatigued to be doing anything.
They can spend a month without doing anything.
Because
it's not happening.
It's not happening. Yes.
So in that case, are you saying, what is it that a man should look at also on the side of men so that they improve their sperm?
So we are looking at the quality of the life of this man.
Right.
Emanating from the type of pants that they wear.
Pants? Like underwear?
Yes.
Okay.
They need not to be tight-fitting.
No tight-fitting underwear for men?
God created us wonderfully and fearfully.
Hanging?
Yes.
Okay.
So the machines where these are manufactured, they're supposed to be at a temperature which is lower than a body temperature.
So when you pull them now, you are taking
when you put them into contact with the body, you are affecting the quality of the sperm. So we are looking at some occupations like truck drivers, bus drivers who are traveling to South Africa and back. They've got their factories very close to them. They are warm. The quality,
I like the factories.
Yes, the quality of the sperm deteriorates.
All right.
Yes,
all right.
and then we talk of conjugal separation. When couples are staying away from one another, they tend to think that because we are staying away from one another,
but no sangana mages.
Yes, when in actual fact the quality of the male is deteriorating.
Is that so?
Yes.
Like you mean the longer he is not active?
Is abstaining, yes.
Oh, is that so?
The quality that comes thereafter deteriorates, so that you may realize that when couples are separated, when then they come together still, they don't get pregnant. But it does not apply to all, because people are different. All right. But sometimes, yes. So
okay. So take me, Doc. Now, okay, the miracle has happened. You know, the baby is now coming on the way. Just quickly take me through pregnancy. What is it that I should look at?
Okay, as you are planning to get pregnant,
Yes.
it would be nice if you visit a gynae, visit a clinic, get preconception visit, have yourself screened for other existing diseases that you could be having, be it the diabetes, be it because diabetes will cause recurrent miscarriage. You've waited so long to get pregnant, but because you're now diabetic, you lose the pregnancy.
All right.
That's one. Secondly, you may be hypertensive.
Yes.
That puts you at risk of losing the pregnancy in the due course.
All right.
You could be having some infections which may also cause you to miscarry. So you need to have a pre-conception visit. You also need some supplements like the folic acid, which helps you to prevent some neurochop defects, like spina bifida or microcephaly, many other things that can be prevented.
All right.
Yes.
All right. So it is important to visit the gynae.
It is important to visit the gynae. It is important to have tests done, screening for HIV and many other tests that can be done. It is also important to get the supplements, like we said, and to book early. Because say you have hypertension or your pregnancy has been complicated with severe hypertension, subsequent complications can be prevented if you then visit early. So booking early is important. Following the instructions is also important.
All right. Thank you so much, Doc. I'll be back with you to talk more. Please look forward to these. We are also at one time going to be talking about kupera libido, kuti mukadzi haachanzwa my feelings and what have you. What is that? We'll talk about such. So keep watching. Auntie Melo, always love you. Till we meet again next time.